Troubling news about that new strain of the variant that is coming out of South Africa, said to be more contagious than Delta, rattling the markets today from the beginning all the way to the end. The World Health Organization naming that new variant now Omicron. South Africa's health minister has linked this one to what he called an exponential rise of cases in just the last few days. That country has quickly gone from just over 200 new confirmed cases a day to more than 1,200 on Wednesday, to nearly 2,500 yesterday. The 27-nation European Union issuing a temporary ban on all air travel from southern Africa. Researchers, though, say it could take several weeks to know if the current vaccines are effective. It is being called Omicron already. Dr. Sophia Deben is an infectious disease specialist based in Miami. And Dr. Deben, as always, thanks for being with us. First of all, your thoughts on what we're hearing about this particular variant, because I got to admit, it's freaking everybody out here where I am in Washington again.
It really has. And, you know, the freaking word is a very real word to all of us. We try and not use that in the medical field because thankfully right now it's still fairly localized to the South African region. Really what's happening is that they're seeing an incredible increase in new cases, up to anywhere from a 30 to 60% increase in new cases compared to just 10 to 25 days ago. Obviously, the weather is turning colder all over the world in the northern hemispheres, but this variant that is showing, it's been shown as called the Botswana variant. It's also been called the new variant, seems to be highly infective, almost some people have noted it to be almost 500 times more infective or easily spread than the Delta variant.
Dr. Deben, here's the problem. Americans, and I think people worldwide, can't take it anymore. They have now said that they have to learn how to live with COVID as opposed to trying to avoid COVID. We just experienced the nation's largest air travel in 2 years. The vaccines and boosters seem to have made some people feel more comfortable. But going into this, how worried should we be?
Thankfully, with the first several waves that all of us have experienced, most of the folks that are highly susceptible to this kind of disease have already faced it one way or another. And obviously, many people have suffered deaths in their family and in their workplace, and that's a very sad effect. But reality is that this virus is going to continue mutating as viruses do. We have so many wonderful ways to address this. Number one, the social distancing and the masks, which we have all thankfully gotten used to. Many of us have gotten vaccinated, and now we have the two medications that are used for patients who are already infected with COVID as a way to shortcut the length of infection. And so we have a lot more options now to deal with, and we know a lot more about the disease than we did 2 years ago.
As we indicated moments ago, Great Britain already restricting travel from certain parts of the world, specifically Southern Africa. Do you expect the United States to follow suit?
I do. The initial report was 6 with the Botswana variant in the South African region and 1 in Hong Kong. We found that there's another one in Israel. Another key point to restricting travel is not only employing that worldwide. The EU is really considering limiting travel to all of its countries. The United States, I believe, will likely follow suit, but also quarantining anyone that has traveled within the last 14 days to those regions prior to this new variant being identified.
Dr. Deben, as they say, this is not our first rodeo with regards to coronavirus, or for that matter, with regards to the vaccines. They started working on the COVID vaccine more than a decade ago. Are you confident that even with this new variant that is coming out of South Africa, that we won't be going through the same trial and error period that we went through in the early days of COVID-19?
I do. One of the wonderful advances that we have seen is this new type of mRNA vaccine. And part of the reason it was chosen compared to a live virus killed, which is what the flu vaccine is that we're able to produce it in relatively large quantities and relatively quickly. In 2 to 3 weeks, we will have the sequencing for the mutations, approximately 30 to 35 different proteins on the spike. At which point we will be able to likely generate a new vaccine specific to this variant in the next several months. But once again, between already all of us as a community being aware and practiced in social distancing, travel restrictions, and mask wearing, as well as the new medications that are out to shortcut the length of a COVID infection. I think that we're in a much better position than we were before. But I also agree with your earlier statement. We are going to have to learn to live with this disease. This disease will continue to change, and being educated and aware, as you and your colleagues are constantly trying to do for our communities, is our best defense.
You know, it's funny. I used to look at the images coming out of the Asian countries and see them wearing masks and wondered, was it pollution? And now I understand that they were concerned at that time about different viruses and diseases there. And now I find myself going into the grocery store or into a mall, and I feel uncomfortable not having my mask. Are those now going to be part of our everyday vernacular? We're going to mask up, we're going to vax up, we're going to make sure we social distance?
Well, Del, I think that that's true. I think that that's going to be part of our life for quite a bit of time. And I think that we will probably go in and out of periods of shutdown and social distancing. It may be, God forbid, that this new variant flourishes or strikes in another area, and they may have to face another shutdown, which, as you know, has many secondary implications, specifically financial. One of the pleas from the Botswana government is that as they enter their fourth wave and their new shutdown, this is the financial support, because as people are restricted in their ability to move about, obviously tourism is a very large part of their economy now. It's the summertime, and that's going to be significantly curtailed. How do we survive, put food on the table, keep the lights on when we're in another shutdown? Thankfully, in the United States, most of us, or many of us, not all, obviously, we've seen in the Black and Brown communities, the less access you have to an internet-based business and the lower your level of education is, the more susceptible you are to significant financial constraints. So yes, I think we will be shifting in and out of that depending on how well the world is able to isolate this variant and keep it in certain areas and not let it explode into others. But unfortunately, these viruses are very difficult to pick up. Usually we don't know that someone has it until they're already sick and they've already passed that period where the 3 to 5 days where they're shedding the virus and it's already been communicated to others.
And I don't want to let you go without pointing out that even doctors get sick. So if you know of where you can find some Thanksgiving leftovers for Dr. Debin, please deliver them to her address. You got the flu, and I know it must have been going through your mind, oh my God, what is this?
Of course. And I'll tell you, I had a really, as a physician, I am exposed to all of the little bugs that are out there, just like parents of young children are between schools and daycare. And as I typically do, I take some medicine, I take a little bit of an anti-inflammatory, a couple extra cups of coffee, and I put myself to bed early. But I had a period where I actually lost sensation in my mouth in the setting that I couldn't smell or taste anything. And at that point, I went running to get a COVID test, and thankfully it was negative. Obviously, I'm already vaccinated, but it's definitely added a new level of fear to everyone. And that's part of our new world. It has affected us in every way. It has affected our relationships, and it's affected our sense of our own sort of mortality. I don't go to the doctor very often when I'm sick. I know what it is. I try and ride it out with vitamins and sleep. But now with COVID out there, and we know that only about between 90 to 95% of people who are vaccinated have an effective vaccine. 10 to 15% of people who are vaccinated will still contract the disease, and some people will even contract it twice. None of us is immune to this specter, and all we can do is try and be proactive, be responsible, be educated, and be comfortable with the small changes that we have to make that otherwise allow us to continue our pretty free, pretty wonderful lives here that we have in the United States.
And we can report to our audience that the doctor is on the mend, although she is without Thanksgiving food once again. So send those care packages to Dr. Deb in Miami, Florida. Doctor, thank you very much for being with us.